Hello, welcome everyone. Thank you for the invitation. I'd like to talk to you about a study that we conducted during the confinement period to look at what are the predictors or the risk factor for increased psychological distress during the COVID-19 confinement and after. So this work has been done in collaboration with my students Kayla Hollett, Sarah Matovic, and Sacha McNeil, and has been funded by the Réseau québécois sur le suicide, les troubles d'humeur et les troubles associés. So when we think about the COVID-19 pandemic, the situation is associated with multiple sources of stress. So we can think about the health threat for oneself as well as close others, the confinement measures that are implemented to curb the spread of the virus are associated with limitations in social contacts and a lot of access to the usual experiences that would generate positive emotions in our life. So these can lead to an increase in distress. And what we are also realizing is that the collateral consequences of these confinement measures, notably the economic consequences, can be an important source of stress for many individuals. So for this study, what our two main questions were, who is at greater risk for experiencing distress during the pandemic? And what are the lifestyle behavior that might mitigate the impact of the confinement on psychological distress? So in order to do that, we conducted an online surveys in Quebec. And the first assessment was about 1 month into the confinement period, so mid-April. Then we conducted a second assessment when the confinement-related restrictions started to be lifted, so at the end of June, and we just started a new data collection right now to look at the evolution of the distress. So for the presentation today, I'm going to be presenting data on the first time frame, really what happened when people were in the middle of the confinement period and after. So when I talk about psychological distress, I think it's important to realize that experiencing negative emotions during the confinement is a normal experience. So people will have more anxiety, some people will have more anger, some people will have more boredom. As a psychologist, when we talk about psychological distress or clinically significant psychological distress is when these negative emotions last over multiple days, most of the days. So in this study, we used the Patient Health Questionnaire 4, which is a 4-item measure that assess anxiety and depressive symptoms. The specific questions that we ask is, over the last 2 weeks, how often have you been bothered by the following problems? Feeling nervous, anxious, or on the edge, not being able to stop or control their worrying, feeling down, depressed, or hopeless, and little interest or pleasure in doing things. So you see that we assess both sort of anxiety-related problem as well as depressive-related problems. And people responded either that they did not experience these symptoms for several days, for more than half the days, or nearly every day. So what we did for this study is that we partnered with an online panel market firm surveys. And what they do, these market firm surveys, is that they maintain large panels of individuals that are interested in filling out different surveys. So there's more than 30,000 individuals within that are living in the province of Quebec. And then what we did is that we recruited about 1,003 adults living in Quebec. And we used quota to make sure that the sample recruited approximated the population in Quebec. So our mean age was 48-year-old. We have 52% females. We sampled both in urban area as well as rural area. And our sample is broadly representative of the population in terms of ethnicity and language. If you look into some of the key demographics, is that most of the people were living with others. About a third, a bit of less than a third were living alone. Most of them were in a romantic relationship. About 60% were at low risk for COVID, so no chronic medical condition that would put them at risk. And this caregiving items was whether they had someone at home that required daily physical assistance. And that could be either young children, adults with disability or older adults that required some assistance. So this is the first slide that presents the prevalence of the psychological distress at time one, so in the middle of the confinement period. And here, what you see on the left side is the normative data. So these are data outside of a pandemic context, and this is during a pandemic context. And let me walk you through what we observe. So when we look at who are the people that are reporting no symptoms of these, no anxious or depressive symptoms, so that's 56% of the population. So what's important to understand here is that on average, most of the people will be resilient. So despite the pandemic, they don't experience increased psychological distress. Although we see that this number is lower than the typical 61% that we would see outside of a pandemic context. Then when we look at people with mild or moderate psychological distress, we see a slight elevation compared to the normative population. But what is concerning to me as a psychologist is that there's the percentage of people that experience severe distress is actually quite greater than what you would see outside of a pandemic context. So what we see is that, although on average people are being resilient, we see a significant minority of the population that will be experiencing greater distress during the pandemic. So here's the data that showed how the distress changed from the middle of the confinement period to end of June, early July. So typically when we do these data collection, it takes about 2 weeks, a 2-week period to collect the entire sample. So the second time point was during the confinement, when the confinement measures started to be lifted. And what we see here is that the good news is that once we started lifting these confinement measures, is that the average level of people experiencing no symptoms increase. We see a reduction in the level of distress, and especially when we look at these two groups, the level of people experiencing elevated psychological distress. So most days, or nearly every day that they have a high level of anxiety and depressive symptoms, still remain more than in the general population outside of a pandemic context. So if we have to summarize, once these confinement measures were lifted, we see that people tended to adjust more, but there's still this subgroup of individuals that continue to experience more distress. So then the question that we ask is, can we identify who are the individuals that will be at greater risk for experiencing psychological distress? And here we assess a range of socio-demographic and economic factors, and we then look at their independent association with psychological distress at time one, so during the confinement. When I say the independent association, it means that we look at the contribution of a given factor independent of the other factor. For example, we do know that people who have less education are more likely to be in jobs that are vulnerable to the pandemic. So they're more likely to lose their job during a context of a pandemic. So then is a lower education, for example, a greater risk factor in spite of losing one's work or job during the pandemic? So let me walk you through the different factors that we assess. So age, the age of the individual, all our participants were adults, sex, education, whether they had young children at home, whether they were working from home, whether they lost their job during the pandemic, whether they had difficulty buying food for themselves or for their family, whether they were in a romantic relationship, whether they had chronic medical condition that increased risk for COVID, if they were living alone, if they were caregiving for someone requiring daily physical assistance, and if they had mental health problems prior to the pandemic. And of these factors, the independent predictors of time one distress were being younger in age, and we're going to come back to that, being female, being less educated, living with someone requiring daily physical assistance, having difficulty in buying sufficient food for one's family, losing one's job during the pandemic, having a chronic medical condition that increases risk for COVID, and having a history of mental health problem. So overall, these results are what we would expect from people that would be at higher risk. But one of the findings that was surprising to us was this one, was the association between psychological distress and age. What we see is that the age group that seems to be experiencing the greater level of distress are the young adults. And this is true despite the fact that the older adults are the age group that will tend to be, on average, more at risk for having COVID-19 related complication and even death. So what we see is that the confinement measures had a much greater psychological impact for this younger age group compared to the older age group. Now, we were also interested at looking at what are the lifestyle factors that would protect against this rise in psychological distress during the pandemic. And for this, the different factors that we assess is whether people were actually adherent to the social distancing measure, how much physical activity, so that is defined as period of time when you're making physical effort that makes your heart beat faster, that you have difficulty breathing, whether there's what are the number of hours per day that you spend doing seated activities, the number of hours per day that you spent watching news, the number of people contacted via phone or electronic devices, perceived loneliness. So if you feel that you feel lonely despite being surrounded by people or not, the quality of your sleep, whether people use alcohol, whether people use cannabis. And of these facts, what I did is that I present them in terms of their strength of association with psychological distress during confinement. So what we see is that the factor that's the most strongly associated with psychological distress is loneliness. So the more people perceive being lonely, adjusting for all these other factors, the greater distress they will experience. And actually, people that report the highest level of loneliness will also tend to experience almost negative emotion nearly every day on average. The second factor that was the most strongly correlated with distress is sleep quality. So people that report having very bad sleep quality have a much higher level of psychological distress compared to people that have either fairly good or very good sleep quality during the confinement period. People who engage in emotional eating also had greater distress. So when people reported frequently or very frequently engaging in emotional eating, they also tended to report greater psychological distress. Phone or electronic social contact with others. So here we see a very interesting pattern. So people that said that they did not talk to anyone outside of their home via phone or electronic media tended to show clearly increased distress compared to those who had been in contact with other people during the confinement period. So when we look at time spent looking at COVID-related news, we see that the pattern is less clear. So it's still a significant predictor, but the association is not as strong. But we see that people who spend more than 240 minutes per day watching news experience a greater level of distress. So then we ask the question, who are the individuals that were at risk of experiencing sustained elevation and distress from the period of time during the confinement period to the period of time after when the confinement measures started being eased. And what we see is that there were only three significant predictor of continued psychological distress. So the first one was having a mental health problems prior to the pandemic. So this was associated with elevated distress across both time points, reported more loneliness during confinement, and reported engaging in emotional eating more frequently during confinement. So if we have to conclude, what we can conclude from these studies is in terms of the lifestyle behavior that people should seek adopting to reduce their risk for psychological distress is really staying connecting with others, but also reaching out to those who might be lonelier around you. So not just the people that are living with you, if you're living with other people, but also making sure that you get in touch with others. Maintaining good sleep habits, so a good sleep schedule that will also help you protect against increased psychological distress, and finding other ways than food to create positive experiences, and also finding other ways to manage the negative emotions that you might be experiencing during the pandemic will be important. For people with a history of mental health problems, making your mental health a priority will also be very important as we're continuing to face these different confinement measures. So thank you. I can take a few questions.
So I found this finding really interesting that your older adults had lower rates of distress, and I might speculate that's because they have more experience weathering adverse events. If that were the case, can we somehow leverage the wisdom and experience of our older adults to support younger people in this experience?
Yeah, absolutely. So I think that what I think is important to understand there's different aspects of why do the older individuals experience less distress. So first, I think we need to think about the representativeness of our sample. So although the sample was selected, was representative of the population of Quebec, we did use an online sample. So it means that these were older adults that although they were up to their 90s, they were comfortable using internet, completing on online surveys. So in that sense, we are not necessarily selecting the older adults who might have more difficulty using the electronic media to connect with others. And I think in terms of the older adults would be at greater risk. So if we think about those living in CHSLD, they're unlikely to have access to these means to complete our surveys. So really the higher risk older adults were not part of the survey just because of the way it was designed. But in general, I think that the idea is that yes, most older adults, although they will be experiencing elevated distress, it will be less compared to the other population. And I think in part, it's because a lot of the older adults are more resilient. So they use different strategies to cope with the current challenges. So one of the way for young adults, for example, what they would say is that they feel that they're losing out on a very important time in their life, right? Where they can't see their friends, where they can't date. And it's very hard for them to face this reality as not being access to these sources of positive emotions. Well, the older adults, very often the strategies that they use is that they say, okay, what else I can do? And basically putting things in perspective to say, okay, this is a time where we need to take a pause, take a break, so allow myself to do that. And then it's fine.
Right, yeah, that's a good point. Thank you. Okay, I'd like to read some questions from the audience now. So Louis is asking, have you been able to evaluate how social media contributed to cause more psychological distress?
So we did not look at social media specifically. So we look at media use more globally. And what we see is that the relationship is not as clear. So people who spend a lot of time, so more than 4 hours a day, will tend to experience a greater distress. But between these excessive users, those who are non-excessive users, it's not clear that it's associated with distress, at least during the confinement period.
Thank you. Here's another question from Catherine Fleming. The question is also about elders demonstrating a lower level of stress. And it is, as a member of the RC Legion, I've had contact with several elders lately, and many of them state, oh, well, if I get COVID and die, it is sad, but there's nothing I could do. Many of them have seen several of their cohort die. So I guess it's more of a comment.
Yeah. Yes. And I think, you know, we were also doing another adult where we're specifically targeting older adults. And what I can tell you, these are more qualitative data, is that a lot of people actually report positive experiences during the first phase of the pandemic, saying, I felt closer to my children, to some of my friends. I thought about my life, where I want to go, how I wanted to spend the time that I left. So not everyone actually has been having I think the media are portraying this very negative experiences associated with COVID, but really it's not, like the experiences varies as a function of the context that you're in.
Thank you. There's a question from Mark E, who is wondering, is the issue with young people's higher distress due to the fact that they might have suffered more employment loss and related financial repercussions?
So we did control for that in our analyses. So that's above and beyond. So the age effect is seen above and beyond the financial losses and job losses.
Okay, I'm just going to take the last two questions that are already up. So next one is, do you think the reason why ages 18 to 29 have experienced more psychological distress is because of this new online reality and the adjustment that comes with it?
Okay, so so this was done, remember that this was done in May. So I think it will be very interesting to see now that we have a group of, for example, of new students that are starting university for the first time, and their experience is on online format. They're not meeting their classmate. They have to adapt to this new workload that comes to the university, but also adjusting to this. And for many of these individuals, remember that it's also managing the different financial obligations. So if you have young children at home, you're working or you're going to school, these factors are also managing all of these factors at the same time is associated with increased stress.
Okay, last question. Do you have information about people perhaps preferring their work from home situation versus commuting to the office?
So we didn't look at that specifically, but what we did look is whether working from home on average was associated with increased stress, and it wasn't.
Okay, thank you very much for your talk.